Good morning, good afternoon. My name is Dr. Carlos Perez, and I'd like to welcome you to Nova Southeastern University. We've got a very interesting panel today, and let me begin by introducing our panel, Dr. Maria Espinola.
Thank you, Carlos. Thank you for the invitation. Yeah, so I'm Maria Espinola. I am a clinical psychologist and assistant professor in the Department of Psychiatry and Behavioral Neuroscience at the University of Cincinnati College of Medicine. But I graduated from Nova Southeastern University, and I miss it. Okay, so now I go on to Sarah, who also graduated from the program.
Yes, hi, I'm Sarah Abul Hassan. I am a board certified clinical psychologist, currently in private practice, specializing in DBT and trauma. Pleasure to be here with you all. And I believe it's Alex.
Oh, well, hi. Thank you for the opportunity. I was invited by Maria. I'm a pulmonary critical care physician at the University of Cincinnati, and happy to be here.
Hi, my name is Dr. Carlos Garcia. I'm also an alum from Nova. We're shark strong today, aren't we? I am a clinical psychologist in the Tampa Bay area. I mostly work with veterans and first responders. I'm going to talk a little bit about sort of my history in that area. Glad to be here. I'm really excited about having this very well-needed conversation during these very difficult times with this pandemic that we're dealing with. So a little bit of history on me is before I went into my doctorate program, actually coming out of high school, I joined the military. I was in the U.S. Marine Corps for 8 years and served 1 year over in Iraq. Transitioned into a job on the fire department as a firefighter and paramedic, and did that for about 7 years before going back to school. So I feel pretty familiar that I can speak from both a clinical perspective, but also from a personal perspective and some of the things that I experienced as a veteran and first responder. I think one of the biggest challenges that we're seeing is not only the pandemic. Obviously, the pandemic is having a significant amount of impact in terms of increased stress, increased symptoms of depression, anxiety, PTSD, whatever you may have. Part of what's happening in the military is there's a lot of military service members that are retiring, and because of the pandemic, they're being called back. They're needed as staffing. There's a lot of veterans that have been in the reserve that are being called back, mostly people in medical staffing and some of those positions. But what this is causing is, imagine yourself retiring after 20 years of work, and a couple of weeks later, you're being called to come back in. I don't know, I wouldn't be too happy about that. So there's obviously the stress of that. There's obviously the stress of the increased exposure that they now have to potential COVID patients. One of the other things that's happening is an increased amount of social isolation for some of these veterans that are already dealing with some mental health issues and not having the appropriate access to mental health care. On the first responder side, again, at the very top, we have this increased exposure to, having to work extra hours, COVID patients, and that causes a lot of distress for folks. But I think the overarching thing that can really impact some of the things that we're going to be talking about today is this mentality of these two populations. And this is a mentality that they are ingrained with from the very first day they start their training. And that is this idea of suck it up, keep moving forward, and don't talk about what's going on with you internally. So on top of the fact that access to mental health care can already be a challenge for these folks, we have this sort of internal belief that it's not okay to. And so what we're going to see there is an increase in the amount of mental health issues. And oftentimes by the time that they come in to seek help, they're already at a point where, their symptoms are taking over their lives in a very significant way and are impacting their families, are impacting their health, and impacting so many other areas of their life. And so I'm really glad we're having this discussion today so that we can talk to folks about, what are some of the most helpful ways that we can help support, these heroes, these people in our lives that are out there, on the front lines, doing what they need to do to make sure the rest of us are safe.
I was invited for the discussion just to give kind of like my testimony of what I've been doing. I'll disclose that here in Cincinnati, in the state of Ohio, just because of swift action by Governor DeWine, the amount of COVID patients that we have been seeing for the past few months has not been as much as New York, as Philadelphia and Michigan. I have a lot of friends, a lot of colleagues in those states, and I can only imagine how much of a mental toll being in the middle of the COVID pandemic has had an effect on them. From my personal experience, and I've worked both in the medical step down and also in the intensive care unit. Initially, back in March, everything was more so like the unknown. We don't know exactly how to handle all of this. There was a huge influx of information coming basically from China and then from Europe. And you could actually tell the mental toll that was actually impacting everybody in the intensive care unit and in the medical step down, from nurses, respiratory therapists, residents, even the attendants. And human resiliency is really interesting in a way that you just adapt and you just pull through. As Carla was saying, I mean, in no means I'm saying that we're actually the military, but we just kind of sucked it up and just, did our job. But it was really hard in the beginning to just adjust to everything that the experts were saying that we needed to do. At home, I just needed to figure out a way to just prevent me from bringing COVID to my place. And at least on a personal experience, I was just, and I still do this. I just go to the basement, I strip down all my clothes, I take a shower, and then I just sanitize everything that I touch to get inside the house. And then after that, I can actually go and see my wife. I have friends all over the states that have been doing the same thing. Some of them have a garage attached to the house, so they've been just doing the same thing in the garage. And starting for that, right, it has been a really appalling experience in a way that you're trying to avoid to bring the disease home. I don't have kids, but I can imagine friends of mine just isolating themselves from their families, staying at motels and not going home for at least the first few weeks until we figured out what we're dealing with and what we were dealing with inside. In terms of patient care, it was the same thing. Probably we just reviewed that right now there's nothing proven, although there is a recent publication that maybe steroids can actually be helpful coming from the United Kingdom. But taking care of these patients has been extremely difficult in a way that you wanted to be there for the patient, but on the other hand, they actually isolated. You don't have the human contact to just be with them and talk with them. You just wear your PPE and will be, really, really lucky to just don't have any PPE shortage at university. But still, it was really, really hard to just be there and also take care of yourself. At some point, I remember there was a patient that needed to be taken to the intensive care unit, gets intubated. I spoke with her, I explained the situation, and all of a sudden, after an hour, her heart stopped, and I needed to do chest compressions. And I remember at that moment that the only thing that I knew, I was there with a fellow and one nurse, as I screamed to everybody else not to come inside the room, and we just needed to do what we needed to do. Unfortunately, the patient didn't do well. And it became real to me. At that time, I remember even I was actually through Facebook, I was in a group about COVID, healthcare professionals. And at that time, there was so much information, so much opinions about what to do. And once I went through that traumatic experience of losing a patient and feeling for the very first time in my career hopeless, that I decided to just isolate myself from that and just try to see what else was after that experience. Um, the other thing that was kind of heartbreaking but also concerning is that obviously because of COVID, all the healthcare organizations were actually in red numbers. And then the institution actually needed to enforce some pay cuts. And I think myself and all my colleagues felt that we were actually kind of in the front line and we were actually exposed to that as well. But in the end, like the organization didn't choose to do that. To lose money, it was the effect of the pandemic. But it was a lot of things that I never thought I was going to be exposed to. Medical school doesn't actually prepare you for this. But I had a lot of support, both from the organization and also through friends. I have good friends in New York again, in Philly, in Michigan, and we found ways to just move forward and just be there for what we do, which is take care of the patient.
Okay, thank you very much. And Sarah.
Thank you so much for sharing that, Alex. Just to hear that experience from another state, I guess we were all going through this at the same time, but, busy trying to take care of our own. Definitely a sentiment I heard from a lot of people I work with. I think a lot of medical doctors and nurses found themselves kind of stuck between the two worlds. On the one hand, a lot of them were like, but I took an oath, I need to show up to work. On the other hand, their families, were really putting some pressure of kind of, we want you safe, we want you here, and being stuck and having to balance both was very difficult. And I would hear a lot of that frustration and sentiment. And then, of course, the same thing actually happened here when these medical doctors that were or nurses that were putting their lives on the line then started getting messages from administration that we need to cut back, we're needing to furlough, or we need to cut down the shift. So it's just a lot of stress that that people face. I actually was invited to the panel to talk about a couple of concepts that I myself witnessed during this pandemic. I think, as Carlos said, people who go into the military kind of expect, and even when they expect to have to deal, like our Army medics, even when they expect to have to make these very difficult decisions overseas about taking care of their own, I think they would all explain that it was a whole nother world of what they had to deal with than what they were trained to do. And then we have our own medical doctors on the home front having to deal with very similar sentiments. The concept of moral injury came up a lot in our discussions, in our professional discussions, and in our work with folks. And moral injury is really, it relates to kind of like the suffering that people experience when they're in very high stake, risky situations. Things go wrong, harm, results, and it really challenges our own deepest moral codes of kind of, I swore to protect, I swore to help. Now I'm being faced with making decisions of who gets the room, who gets the ventilator, who gets, to go home today. Do I stay for an extra shift? So definitely a concept that came up a lot, and that's very difficult because that's very different than, for example, a traumatic experience. It's not necessarily the shock or the high risk stake situation, or the typical stress reaction that we would see in a case of traumatization. This is really more of like that hits us deep in our core values and the way we live our lives, or what we stand for. And one that, I'm hoping that we would, touch upon how to assist people talking through or expressing having to deal with this burden of the human condition and what they had to witness, bear, deal with, assist, you know, as Alex shared, what he had to go through with clients who, you know, or patients who were in the hospital, can't speak to their families, and they can't actually be of much solace to them either. So I know that at some point we are going to touch on some skills. You know, I think secondary traumatization is also something that can show up in hospital settings and for medical professionals. I actually surprisingly heard that a lot less than the burden and the sense of like burnout or the sense of like the despair people were dealing with. Though, of course, secondary traumatization is also something people have to deal with. Things like even compassion fatigue, you know, just having to be there present for people. We as psychologists are kind of, you know, trained in doing that. As Alex pointed out, medical school and other frontline workers don't necessarily go through that intense experience of, you know, self-care, how to ward off burnout, how to walk with someone as they're suffering. And I think that just left a lot of professionals feeling like they're alone. And so I'm glad that we're here to kind of talk about some tools and some skills and some basic strategies that people can learn or people can utilize to get through some of those very difficult moments.
Thank you so much, Sarah. And Dr. Espinola, Maria. Maria, unmute, please.
Thank you so much, Alex, for sharing, and Carlos, and obviously Sarah for sharing your expertise too. Yeah, I think yesterday I was in another panel. It was some PTSD and trauma, and we also had a frontline worker there, a surgeon. And she said that one of the things that has been helpful to her and some of her colleagues is just to take a time to, you know, take a pause. So grounding skills seem to be very helpful. So when the coronavirus epidemic started, I decided to start a YouTube channel because prior to that, already people had a lot of difficulty getting in to see me, sometimes like waiting for 6 months. So that led me to just be very worried about them, about what was going to happen to them. And then when the epidemic started, I just like took that step to make it available to as many people as possible. So I do share some grounding skills there. I mean, the most common 5, 4, 3, 2, 1, just like going through 5 things you see, 4 things you can hear, 3 things you can touch, 2 things you can taste. So like you go like every single one of your senses. And then I think that can help people just to ground themselves and be present in that moment. Then I do teach other ones that can be like also helpful. So at McLean Hospital, where I was there for a year, we will use a frozen orange, which sounds a little odd, but we will have actually the frozen oranges in the refrigerator at all times. And when a person will be very, very stressed, we will give the frozen orange and place that on the palm of their hands. And that would allow the person just like to immediately look at the orange, like connect to that cold sensation and then the bright colors. And then the person will scratch the orange a little bit, and that will allow them to be present. So those are like different skills. I mean, if that is not possible in the setting they're in, it's just very simply take a minute to say, okay, what's going on in my mind? What's going on in my body? I think it's very common, and it's important to normalize that if you're dealing with life and death situations, you will probably gonna get the fight or flight response. I mean, we oftentimes, when as psychologists, we deal with suicidal patients, we may get it. So, and that is automatic, and we don't want to eliminate it. It can be very helpful. It can help us survive situations. So we have to actually be grateful that we have it. But once we realize that we are getting that response, what we need to do is to take a step back and say, okay, what's going on? Do I really need this response? Is it going to be helpful for me to physically fight someone or run away from this situation? And it seems like kind of like obvious, but we don't think about it, right? Like in those moments we get into the fight or flight response, and it's kind of like hard to take a step back and realize what we're doing. So those are some of the things that we discussed with the physician yesterday, and I think that could be helpful for others on the front line.
Maybe just one thing I want to just piggyback on what you just said, Maria, as far as like the skills, you know, I've given some of these talks, and it was interesting. After the Orlando response, I was invited to give a talk on kind of compassion fatigue. And we talk about a lot of those things that, again, oftentimes maybe therapists have to face. Us as psychologists kind of have to get trained and you know, in dealing with, though in reality, this pandemic just made all of us realize we're all part of the same shared human boat experience, going through this experience together. And then, you know, concepts such as, you know, we talk a lot about stress, we talk a lot about stress reactions, and then we forget that part of the human conditions is also survival, is also, you know, sometimes resilience. What we still even know about trauma and PTSD type of presentations, that, you know, most people actually end up experiencing post-traumatic growth as opposed to PTSD when faced with high stress situations, provided they use some of those strategies and some of those techniques to kind of ward off some of that difficulties. And when I think of the skills, I love the ones you just mentioned, Maria, because really they're so useful and can be used anywhere. And really, and wherever you're sitting, you can pause to do some of those things. Other things I would probably add to that list is, if folks don't have it, this is actually an application, a phone application that you know, the Department of Defense actually developed back in the day for psychologists. Psychologists helping people who have gone through trauma. Though right now, I feel like this app would be applicable to anyone in a situation of caring for someone dealing on whichever side of the pandemic. It's called Provider Resilience. It really measures, you know, it tracks your burnout. It's a very interesting app. I really recommend everyone in the profession actually download it and get it. It tracks levels of burnout, measures people's quality of life, what are some areas they can be working on, implementing something like the buddy system, like with what Alex was sharing, that, you know, his friends and his, you know, kind of carried him through, having someone to vent with. Those become also very important things, or potentially helpful things that people can also utilize, which we'll circle back and I'll speak a bit more about some of these things. Now I'll leave it to Carlos.
I actually wanted to jump in and say a few things. I think some of the clients that I've been seeing lately have had sort of a hard time understanding why they're so stressed. I mean, obviously there's you know, significant changes, but I think we often think, you know, that our resilience levels are a little bit higher than we believe, until we're faced with something as serious as this. And so one of the things that I've been seeing is that this pandemic has really forced people to sort of take a good look at what's been going on in their lives. So has there been a disconnection in their marriage? You know, have they been unhappy at their job for months, right? And so now we've had this pause, and people are sort of forced to like look at, oh my goodness, you know, maybe I've been unhappy. Maybe there's stuff going on that I haven't been attending to. And that can be a great source of stress. I also talk about the fact that for the most part, as human beings, we're sort of wired to feel more comfortable in an environment that feels structured and certain. We don't like uncertainty. And so this pandemic has just thrown this uncertainty and uncontrollability at us. And often, for most people, we haven't known how to respond. Even for myself, I had to sort of reevaluate, like, my goodness, I think I'm a workaholic. I think that's my way of coping, right? A healthy way of coping, but not really. And so I think sort of looking at that as a positive in this very sort of horrible thing, you know, that we've been experiencing. I've seen a lot more people calling me wanting to work through some of their, you know, some of the stuff that's coming up for them. So I think in that regard, it's been really beneficial. And I'm glad people are reaching out. It's, you know, it speaks a lot to not only their level of suffering, but in some ways maybe getting past a little bit of that stigma, a little bit of that idea that we need to just suck it up and move forward.
So one of the first questions that came in is not really a question about a mental health, but in some ways it is to wear a mask or not wear a mask.
To what?
Should we?
I feel like it's only fair for Alex to have to answer that.
Alex, should people be wearing a mask? That is the question. What do you think?
Well, from a physician standpoint, I would say definitely yes. From a more holistic way of seeing us as all equal, I would say yes. However, again, and it's more so that I see it here. I'm from Peru, from South America. And I believe that we're similar in a lot of ways with America. But there is so much uncertainty and so much this desire to go back to where we were a couple of months ago, that even asking somebody to wear a mask kind of just reminds them that we're still going through this. So I try to understand sometimes why there's some people that would actually disagree or even go out to the streets to just say that you cannot mess up with my freedom. But again, it's one of the good things about democracy is that your opinion counts. But again, if you ask me in terms of using a mask, I would say definitely yes. Any mask is good. You don't need an N95 to just be okay. You can use anything. But it's more convoluted than just asking or enacting an order to just do that. Governor DeWine actually ordered the use of masks, and then he had to backtrack a couple of hours because he knew what was coming. And again, it's difficult. At least I would tell you for the panelists here and also the viewers is that at least I come to work, I get a temperature check every single time. They ask me every single time if I'm feeling okay. And then they actually make sure that I actually have a sticker, and then I actually have to wear a mask. I think that needs to be done on every place that you actually go, but that's my personal opinion as well. But again, it's really hard to just be on the same page because again, I understand it's something that I need to do. I understand the reason why to do it. But people that they don't want to do that, then maybe they have things going through their lives, as Carlos and every panelist in here were saying that I don't know, and then they just decide not to.
Panelist, Sarah, some of the attendees are asking for the app. Please go ahead and give that to them and make sure you select.
I posted that.
Make sure you select all panelists and attendees. And Maria, they would like your YouTube channel as well.
Okay.
And Provider Resilience from the Department of Defense can get that app. I think that's what you mentioned. The children are much better in structure, and certainly this has thrown many of them, and particularly in special needs groups, into panic. Many of the groups I'm associated with, children are heightened, and it is more difficult because the parents have no outlet. So we're going a little bit into the parents and the family, and I can imagine with first responders and people in the medical field, this has got to be an extreme situation. There's many single parents, the participant mentioned. Can you talk a little bit about the children in our lives?
I don't necessarily work with children, but I do work with some of the parents who are trying to navigate some of these issues. One of the biggest complaints that I hear, obviously after concerns about health issues and even some potential furloughs or loss of job, is a lot of parents have been forced to become teachers, and it has been really, really challenging. to add this very additional, this additional very stressful role to already being a parent, especially if they're single parents. And so some of the advice that I give, again, it goes back to this idea of structure. If us as adults like to function so much in that space, then just imagine children that can experience a greater sense of discomfort and panic when they don't feel certainty, when they don't feel safety. They might even pick up, if the parent is very anxious, they might pick up on some of that. And so I think it's very important for parents to sort of, work through some of their stuff, whether that's through counseling or through support from family members or friends, so that when they communicate with their children, they are communicating in a way that feels a little bit more calm. And to communicate to children, I think sometimes we forget or we don't really understand just how much children can understand and how much they can process. And so I'm not talking about putting a lot of stress, adult stress on children, but I think communicating to them and helping them understand, here's why you can't, here's why you're not going to school right now. Here's why, we have to be trapped at home. Here's why we can't go to the park. And I think that communication really allows them to feel a much greater sense of safety and structure, which can impact, the way that they're going to behave, the way that they're going to, experience day to day.
I just to add a bit to that, again, even just relating to people who often have to live in places like war zones and deal with things like this. And really, we're now talking about this in almost every household in America that's having to deal with this. I think connection and community support when it comes to children, and that open communication is something that has been shown. When we look at any trauma, whether it's mass trauma, single incident trauma, that kind of social support and connection becomes so important. Yet in quarantine, people were not able to get their social support, right? So they had to get very creative in ways to doing that to stay connected. And I think that's just very important for children as well, right? Adults are doing it. How can we set up some of those? I know I heard a lot of parents talking about setting up play dates on Zoom. Of course, depending on the age, for kids that are very young, that was just not doable. And I would say one of the highest stressors parents had to deal with is being forced to be teachers when that's just not what they did. I hear people talk about, I went to school for this. I wasn't cut out to be a teacher. And a lot of people have this new profound, respect and understanding for every teacher out there. I've definitely heard that sentiment from every parent that I've spoken with, of just how much they appreciate teachers and what they have to go through.
Mm-hmm. That's good. Yeah, one thing that I would add is just like for parents, particularly for single moms, to be very compassionate to themselves. I mean, I think like especially women, put a lot of pressure on themselves. Society puts a lot of pressure on them too. So, I mean, I specialize in working with women, right? So one thing that I discuss with them often is gender socialization. All the messages that we get about like always like putting others' needs before our own and being this perfect mother and this perfect professional, and be happy all the time, and like nobody's that happy. There's nobody's that happy, especially when you're like dealing with so many pressures. So it's just like just be more compassionate. And I think this epidemic really brought up something that I hadn't seen before, and it's like people actually expressing their frustrations openly about raising children. Before that, it wasn't a common thing to see at all. And it would be a very common reason for women to come see me. So they will come like not only with the frustrations of raising children, oftentimes by themselves, but also with the fear of speaking out about it and like sharing those thoughts for fear of being judged negatively by others. So I think it's really important to promote compassion.
So a couple of messages that came in. Ellen mentions that New York has one of the lowest, went from highest to one of the lowest rates after a law was passed for a mask. Jean mentions the trust. I believe that's the trust for those that are not in psychology. That's the psychology organization, correct? And here's a question: as a pregnant student intern who's working COVID-19 patients, who works with COVID-19 patients in Northwestern Hospital in Chicago, I don't feel comfortable being at my site where no one is wearing a mask. It's scary. I'm sorry. I know this isn't a question. I don't understand why rehab facilities in Broward tell their staff and patients it's okay not to wear a mask. So this is very real. What do you think? What do we tell her? She's pregnant, very concerned.
Yeah, I think it's important to speak up. Just like to see and who is in charge there, to send an email to educate them, about the risks that she's facing as well as other people there. And just, yeah, I think education, advocacy, also like seeing who else may be impacted, who will be showing the costs, I guess. I'm a big fan of advocacy, as everyone knows. So I think it's a good idea always to see like who else may be impacted so we can collaborate and promote a specific cause together. It doesn't have to be like a fight. It doesn't have to be it's just sometimes like simply educating people and telling like, because I don't see like what would be the cons of allowing them to wear masks. I don't understand that. So sometimes just simply giving the education will be sufficient. I don't know.
I mean, I think unfortunately what we're witnessing in this country is, and I really, is that there are, even in Florida, I can only speak about the Florida experience, you're going to walk into places that are taking it very seriously and people are wearing masks and, adopting what people have said as far as strategies. And then you walk into areas and you would think that we are not dealing with anything and people aren't necessarily wearing masks. And I think that's just been another added frustrating thing that people have had to deal with, is that divide in information. Like, how do I know what is true and what is not? Is kind of what we're witnessing here. Maria, I think she said that there's a couple of places she knows of in Broward where people are not necessarily doing that. And I agree with Maria. It's kind of like figuring out how to advocate with things like this, things as serious as this, especially you're saying it's a hospital setting, figuring out what is going on, even potentially considering reporting it to the state.
Sorry, and if that cannot be made, the only thing that I can tell you from a physician's perspective is you can wear a mask, you can wear a face shield as well, and try to avoid crowded areas. I mean, easier said than done, but if there's nothing else that you can do and you feel that everything is against you, but you cannot stop going to work or going to study, then you cannot do those things. Here at Cincinnati, at the University of Cincinnati Medical Center, initially we started only with masks, and now when we are in patient care areas, we also have to have a face shield as well. So my recommendation, as much as people may actually look you weird or anything, is wear a mask, and if you have to have a face shield, you're going to do that as well. And avoid, obviously, areas with a lot of people in there.
So a new question is, how can we be there for healthcare professionals in our family? And she goes on to add that her dad is a nurse. Mm. How can we be there to support people in our family that are working the front line?
I think sometimes we overcomplicate this idea. We want to think of all of these ways that we can be helpful. And what I've come to know from this work that I do is the absolute power of listening, of just listening, of being a shoulder to cry on, of being an ear for someone to vent to. Oftentimes that's really all we need, right? We don't need advice. We don't need someone to jump in and sort of help us out of the situation. Rarely do we need that. But when we feel heard, when we feel listened to, when we're going through something difficult and we can share that, that's such a powerful thing. If you've ever thought about a time where you've been going through something difficult and you've been able to share and open up about that to someone, if you reflect back, it feels good. I mean, just letting that out can be really, really powerful. I think another good way to be there for family, or, you know, for the first responder, or, you know, some of these people on the front line, is to sort of be on the lookout, because stress looks different for everybody. And so we're not necessarily going to see PTSD symptoms. We're not going to necessarily see depression or suicide. Sometimes it's just an emotional disconnect, a space from family, not being present. Sometimes it's increased agitation or anger. Sometimes, I mean, it could look, you know, a loss of sleep or irritability. It can look so many different ways. But if you notice that someone in the family is just not sort of being themselves lately, a simple question like, hey, you know, how's it going? You know, how are things? How are things been lately? And that's it. And just sort of let them go. I think that, you know, that holds a lot more power than we think.
That's a good advice. I also would add, I mean, she mentioned the dad, so like, I don't know how old is her dad, and like some men don't feel really comfortable opening up about emotions. So I think another way to be there for dads is like, so one is like offering like something, like be like, you know, cooking something, or just like doing something nice for the person. Or asking them to do something for you could be like, so like I would ask my dad like to change a bulb, or to like help me with like some simple things, even though I know how to do them. I would ask him anyway, because like it makes him feel like he's helping, he's useful, he's being nice, he likes that. So I don't know like what her dad's personality is like, but that's what I see very often on older men.
I mean, I think also, just to piggyback on this, is, you know, the art of validation is what I would maybe add to what Carlos is saying, and kind of what Maria is saying, actually getting creative. And I think, you know, for me, validation goes a step beyond just listening, and that's really kind of communicating understanding and offering people the space to share without necessarily pushing for the sharing. As well, and just having that delicate balance of kind of, you know, I'm here if you want to talk. I can't imagine what things are like. And then when the person does open up, just, you know, sticking to the communicating of understanding that, oh, that, you know, that must be tough, you know, and being careful to communicate that understanding piece, as opposed to, well, jumping in to solve the problem, you know, just being present, really sitting with people as they go through this.
Alex, is there anything we could do for you?
It's been, you know, like I always like to be, all my life, ever since I was in med school, I hang with my med school friends and we talk about medicine. So this webinar has been really interesting to me in a way that, because you guys are the experts, there's a lot of things that I didn't know about. I think for a healthcare provider, including myself, and, you know, I've been listening to Carlos, to Maria, and to Sarah, is what I did, which is basically just share my experiences with close friends of mine. Actually, my mentor is right now in Philadelphia, and I was talking with her almost every day. But I think it's always that stigma that you actually want to avoid, in terms of, I don't need help, this is what I trained for, and nobody was prepared for this, but I'm a physician and I need to be there for my patients, right? But I think it's really, really valuable and of help to just know that, number one, it's never bad to just admit to yourself that you need help after, you know, talking or sharing about your experiences with somebody else. And if you still feel that you're not back to your usual self, that you can always reach out for help, seek the help of a professional, and realize that you're not the only one. I mean, I've been blessed in a way that, two things. One, my wife at home was very supportive. Again, talking with my mentor in Philadelphia was really helpful. Talking with my friends, I have an infectious disease friend, very good friend in New York, and he was telling me all the horrors that he was seeing. But again, just realize that it's okay to feel down. It's okay to feel human. Going back to that experience that I had when my patient actually died in front of me, and I think that was one of the few times that I was in the garage and I needed to just weep out, a little bit just to get through that. Because it was really hard to just realize that I was talking with her a few hours ago, and then I had to interact with the family 2 or 3 times, after that. I can only imagine what my colleagues went in New York and Philly, because what I experienced is probably multiplied by 1,000, what happened in there. But again, really grateful to be invited and here and just listen from a other specialist point of view, how you actually navigate through this uncertain time.
So, panelists, we've got just tons of questions, so I might have you pick one that you want to answer. I want to ask one that is by a dear friend. Thank you so much for such human care. My question: we observe behaviors that reach the public environment that it involves professionals such as police. What are you sharing? Can you say that police officer, by the nature of their occupation, would be diagnosed with this human condition, primary or secondary trauma, flight or fight response that is conditioned in that person that brings out post-traumatic stress? He goes on to say, thank you all for your service to humanity. Complex question. You could touch on some of those points and then also draw from the other questions.
Carlos, I didn't actually quite get what you meant by that. Could you just rephrase that instead? Because I can't read it.
Yeah. Let me get to
Maria. I know you wanted to say something. If you understood that, jump in.
But what the person is asking is like if it's PTSD is a common experience among police officers, which it is. So I think that's what I'm getting from it. Yeah. Mm-hmm.
Yes, and I assume that in the frontline workers in a medical setting, they're being traumatized. I know personally. I have a college friend who's a nurse in New Jersey and a friend who runs an ER in Brooklyn. And what they've been experiencing, they've been dealing with an amount of death that has been astronomical. This has got to be traumatic. Absolutely. Can you talk a little bit about that trauma?
Yeah, so probably Carlos would be the best person to answer.
Yeah, I can sort of speak to this, maybe not so much from the police, but I think police and firemen share, so much of sort of the same work and experiences. And one of the things that I noticed a while back, transitioning from the military, and especially military service members that had served in combat, and firefighters and paramedics that were exposed to trauma almost daily, I started to wonder if there was a particular type of personality or characteristics that sort of led a person into this sort of field. Because what I noticed was that I don't know if they were just really good at hiding it or it just didn't show up until much later. But to see these folks be exposed to so much trauma, to so much stress on a day-to-day, and for the most part, be able to keep it together. That was always so amazing to me. And we talked a little bit about, or I know Sarah mentioned post-traumatic growth, but there's also this concept of resilience. And so I never got around to the research. I'm not a research person. I prefer to sit and chat with my clients. But I think there are some characteristics that allow some of these folks to just be more emotionally and psychologically resilient to some of this trauma. But what I have found, and this was personal to me, was that it was only years after leaving these careers that I started to notice that there were actually things that I had been repressing, not looking at, and not dealing with. And the only way I knew that is because someone asked me to share my story about those careers. And I remember almost going into a panic and realizing, oh boy, I didn't know some of this stuff was there. And so I'd say that they're absolutely impacted by this. And, I think no matter how resilient we can be, it's always helpful to just reach out to somebody, whether it's a counselor, psychologist, or even a peer, because sometimes, again, this, the people in these sorts of populations, are sort of trained and told not to do that. But I think it's braver, even with these police officers, firemen, veterans. I think the braver thing to do is to admit to yourself, I don't have 100% control of this, and I can't do this on my own, and to reach out to somebody.
I mean, I think I would add kind of, thank you for that reminder there, Carlos, of kind of, it's quite typical for everyone going through this high level of stress to experience what we call acute stress reactions. That's kind of like the typical human response. The truth is the vast majority of us are going to experience some symptoms of acute stress early on in the face of something like this. Though the idea here is to try to enhance resilience and prevent long-term development of something like PTSD or post-traumatic stress. And what I have found is really early intervention and self-care in those areas becomes key, and I think one of the biggest things is meaning-making systems, right? Being able to practice a certain level of acceptance toward, and by acceptance, I hope, people know enough about the concept of radical acceptance that I'm not necessarily talking about approval. I'm really talking about the realization and coming to terms that I cannot control this. The suffering exists. I don't have control over this. What is it that I can make of this to come out, or what is the meaning I can adapt from this while this is happening to help myself on the long term, my children, my family, our communities at large as we walk through this. I think that's the one thing I would add, is that we really are looking at something that affected all of us on a very large scale. In a large sense, the positive is that now we're all feeling a bit more connected towards our humanity and towards each other, or at least one would hope. And the idea is, how can we come together as communities, regardless of the health care discipline that we're working with, and carry or walk with each other towards the other side of this, because it's still going on. And it's hard to talk about things like post-traumatic stress when the trauma is ongoing. Right now, there's stress of a second wave. People are hearing things in the media like, "Oh my God, be careful! Don't not wear a mask, don't go out," and it's very hard because this is kind of like an ongoing type of stressful situation that people are sitting with. And so, how do we look ahead with this, and how do we come together and use some of those tools we discussed today to hold with that?
I'll take a couple more questions. What 3 questions would be of value to ask to get the mental health pulse of a human service provider? What 3 questions would be of value to ask to get the mental health pulse of the human service provider?
I don't know. A part of me wants to go back to the basics. When was the last time you ate? Did you sleep okay? How are you feeling today? Kind of honestly, like those basics of self-care strategies that are usually the first to go out the window when people are burnt out. That would kind of really checking in on their self-care and just the general, kind of like Carlos said, how are you doing?
So you said sleep, eat. Is there a third one, anyone?
And how are you doing? Sorry. Yeah, go ahead, Maria.
Yeah, exercise and socialization. Another thing is like to give you can ask like from 0 to 10, 0 being like nothing and 10 being the most stress you have ever felt. Where do you think you're at right now? That can give you, and physicians do that a lot with the physical pain. So like they're used to respond that. One thing really important to remember about this is like, even before the pandemic in 2019, they did a research and they found that about, so 1 physician dies by suicide every day in the United States. Is the profession with the highest suicide rate. So something important to remember and to be aware. I think like we see physicians oftentimes as superheroes, we applaud them, we love them, and we don't like, and they themselves, sometimes they feel like they have to portray this strong, powerful image of caring for others and being always on top of things. And it's really important to remember how risky the profession is. So sharing some of those resources will be helpful as well. in terms of suicide. I don't know, Carlos, if you want to say something about that.
Well, I see whether we have about 5 minutes left. I know that that was a topic that we were going to cover, but just to say something briefly about suicide, and I think this is another one of those topics that a lot of us can experience some discomfort. I mean, I know some early clinicians that have a discomfort about speaking about suicide, much more sort of the lay person. There's this idea of like, if someone is suicidal, let me not ask or bring up the topic because that will encourage them to do it or to have further thoughts about it. And obviously that's a big myth and a misconception. And, I think when we see that people are suffering, I think by the time that they're having some suicidal ideation, there are some external things that we can see in terms of, disconnecting from others, in terms of isolating. And, I come back to this idea of, just being there and asking, hey, how are you doing? And like Sarah says, I love what she said about like validating, right? And just like, yeah, I mean, I get it. I can't imagine what it's like for you with, with everything that you're going on right now. Right. And not getting into this fix-it mode, but of just really being there. And, suicide is a sort of a very complex issue, but I don't think we need to be afraid to address it, to talk about it. And if we are afraid, then we might, in some ways, make that person feel more ashamed about what they're going through. And I think, we should never, ever, any of us feel ashamed of going through challenges and feeling down at times.
So I'm just looking at the very serious question that came through, Carlos, on the topic of suicide with the person asking about their daughter and just recognizing the time. One resource that I would want to make sure people know about is the National Suicide Lifeline. The number is 1-800-273-8255. They are a wealth of information and a great resource. It's a national organization. They'll talk you through everything you need to talk through. I'm sorry, it's just because we have limited time for me to address exactly what she's asking. That they'll give you all the local resources. They'll also help you talk through the steps of how to support someone who is struggling with this, and some of the resources that you might find helpful to be present for your daughter.
Yeah, in terms of suicide resources, I also created a video. So it's like how to deal with a crisis. So, and there I share the TIP skills that are from DBT, and I also share the 1-800 line and international resources for suicide, and it's in English and Spanish.
And also on the webpage where we host these events, www.nova.edu/shark-chats. Dr. Poland has an extensive video on the subject as well. We encourage you to view that and utilize those resources. Panelist, can I get your final word, your final thoughts?
Well, thank you so much to everyone. Thank you so much for the invitation, Carlos. Thank you so much for all the people who joined today, all the panelists. I just want to, so I hope that this will be helpful to people in the future. Just one more resource to help those who help us.
I'd just like to share, really quickly. Sometimes, I come into my office. I'm sort of alone here. I have my own private office, and so, we talk about validation and feeling a sense of connection. Just this today, knowing that there are other folks out there that sort of, the challenges that they face in their career made me feel better. And so I think, the power of connection. It's so beautiful. So thank you all for for sharing, sort of, your own experience and what this has been like for you all.
Thank you so much for sharing that, Carlos. I mean, I have to agree. I was running a group last night, and one of my patients who just suffered a loss due to COVID kind of reminded all of us and paused and was like, I want to remind everyone here to please check on your loved ones, stay connected, because you really don't know. And these avenues are so important. So, staying connected. And I'm very grateful for the invitation as well to be here with you guys, Alex and everyone, you know, and Maria, thank you for the invitation. It was a pleasure talking to you all this morning.
For the invitation, the only thing that I would actually add is together we'll get through this. That was my only message that I was actually giving all the people that I work with at the beginning, now, and probably for the future. Thank you very much for the opportunity.
Thank you all very much. One of the things I like to give a little takeaway, and I heard sleep, eat, and exercise someone mentioned. And I think it's especially important, of course, with our frontline workers, but also with our elders. So we should know that our family members are having some movement and stimulation. So for everyone, reach out to your friends and some people that you haven't reached out to in a while. We are at Nova Southeastern University. I have the pleasure of hosting this great panel. I work with the College of Psychology, where we have bachelor's, master's, specialist, and doctoral programs. And we also have a clinic here in our facility. We're going to be hopefully operating fully soon, and we'll keep you posted. My email is perez@nova.edu, and please call on us. Have a great day.